Hello guys, welcome to our another anatomy lecture. Today we're going to talk about the optic ganglion, optic ganglion, pterygopalatine ganglion, and the submandibular ganglion. So these are the most important ganglions in the head anatomy. So you need to understand them. You need to know the causes of nerves, the nerves that make up this ganglion, and the structures that are innervated by each ganglion. Right. So here, this is a summary of these ganglions. So I'm going to start with the ciliary ganglion. So the ciliary ganglion can also be called the optic ganglion. Right. It is going to be mad. Remember, we said we have four nerves: cranial nerves that are involved or that carry or that have a nuclei for parasympathetic innervation. So you can just use the mnemonic 3 plus 7 is equals to 10, not 9. So if you arrange them in order, you're going to have cranial nerve number 3, which is your oculomotor nerve, cranial nerve number 4, your trochlear nerve, cranial nerve number 7, your famous facial nerve, and cranial nerve number 10, that's your vagal nerve. So moving from this, as you can actually see here, this is your cranial nerve number 3, your oculomotor nerve that will form the ciliary ganglion that will go to supply structures, muscles that are in your intrinsic muscles of the eye. Right, so you have the intrinsic muscles. For example, you're going to have your ciliary muscles that are responsible for the bulging of the lens, as we're going to talk about later. You also have um your sphincter pupillary muscles in the iris, responsible for constricting the pupil during the rest and digestive phase. There's the parasympathetic. You also have those all those muscles, the intrinsic muscles, which needs to have parasympathetic. They are going to be innervated by the ciliary ganglion, as we're going to see. And the second nerve is your cranial nerve 7. Your cranial nerve 7 is very important because it actually gives two ganglia. It supplies two ganglia. The first one being the pterygopalatine ganglia, and the last one being the submandibular ganglia. So you have to take note of this: the pterygopalatine ganglia and the submandibular ganglia. They all receive parasympathetic innervation, parasympathetic pre-ganglionic fibers coming from from the facial nerve, which is cranial nerve number 7. So this is your pterygopalatine ganglion, which will be found in the pterygopalatine fossa, as we're going to see. And then the third one is going to be your optic ganglion. Optic ganglion. So this optic ganglion is going to be right inside your infratemporal fossa. Your infratemporal fossa, you have your optic ganglion, and then lastly you have the submandibular ganglion. So let's take a look at these ganglions, and let us summarize, just a summary that you can actually appreciate these ganglion, the structures that are going to be innervated by the post ganglionic nerves that will be coming from this ganglia. Right. So now, point note: ciliary ganglion, right, is going to the orbital, um, is going to the orbital cavity, that is with to supply intrinsic muscles of the eyeball. Your pterygopalatine ganglia is going straight to what you call your lacrimal apparatus, and then your optic ganglia, it goes for the parotid gland, and then lastly your submandibular ganglia, it goes to supplies two glands, right? Your submandibular gland, obviously from the name, and the sublingual gland. So let's take a look at these causes, right? Good. Right. Now let's talk about the ciliary ganglion. Right. So your ciliary ganglion is going to receive from parasympathetic innervation, which parasympathetic or pre-ganglionic parasympathetic fibers from your oculomotor nerve. So you have your oculomotor nerve. Remember, your oculomotor nerve, it supplies most of the muscles that are your extrinsic muscles of the eye. That's your superior rectus, inferior rectus, medial rectus, right? And your inferior oblique muscle, they are all innervated by the oculomotor nerve. So in oculomotor nerve, it actually carries both somatic, right, as well as autonomic, the parasympathetic part, because it also supplies these muscles somatic innervation to these muscles. You understand? Good. So the oculomotor nerve, you can actually see this oculomotor nerve, right? The oculomotor nerve, it will be carrying preganglionic parasympathetic fibers, right? And then these preganglionic parasympathetic fibers, they're going to be channeled into the ciliary ganglion via the nerve to the inferior oblique muscle. So this is going to be your nerve to the inferior oblique muscle, right? That is going to transfer the preganglionic parasympathetic fibers into your ciliary ganglion, as you can see. So your oculomotor nerve, it has various division, right? That will be sent to these muscles and so forth, right? But one division, which is called the nerve to the inferior oblique muscle, is the one that is going to carry the parasympathetic, right? And then you're going to have the parasympathetic preganglionic fibers, right? Anastomosing, right, or forming synapses within the ciliary ganglia, right, forming the post-ganglionic parasympathetic. So take note of this. The pre-ganglionic fibers of parasympathetic, they are actually longer than post-ganglionic fibers of parasympathetic. And in the case of the sympathetic, the preganglionic fibers or nerves, they are short. That's why you actually have your sympathetic trunk being formed at the neck of your vertebra, at the neck of your ribs. Remember the neck of the ribs, right? That's where you have a chain of this sympathetic trunk. That's where they form their ganglia. So you can actually see you're just moving from the spinal cord, then straight to the ganglia. So the pre-ganglionic sympathetic nerve, it's actually short. You understand? So it gives a long post-ganglionic. So you can, in there, these four ganglia that are formed, they are parasympathetic ganglia. They are not sympathetic. They are not sympathetic ganglia, because the sympathetic, it be a post, right? So it does not interact with these ganglias. I hope that is noted, right? So let's go again. The oculomotor nerve carries both, right? It actually going to have um a nerve that we say a nerve to the inferior oblique that will carry parasympathetic preganglionic, and they will form a ciliary ganglia. The ciliary ganglia will send post ganglionic fibers via the short ciliary nerves, right? So you are going to see throughout the course of this video that the branches of the trigeminal nerve are the ones that are going to carry the post ganglionic fibers, right? But but the parasympathetic does not come to the does not come from the mandibular or the maxillary or the ophthalmic. It will be coming from those three cranial nerves, right? So the trigeminal nerve is known as the carrier of the post-ganglionic fibers. So it is a carrier. It does not form. You understand now? Good. So in this ganglia, you're going to have, this is your bulb of your trigeminal nerve. Is It gives your ophthalmic nerve, which is the cranial nerve V1. And the ophthalmic nerve is going to divide into three. This is actually your frontal nerve that will later become your supratrochlear and supraorbital. And then it's going to continue as it's going to give another branch that we call the lacrimal, right? That will give a palpebral branch to your lacrimal apparatus, right? And then this one, that is one we are more concerned with, that's your nasociliary nerve. So the nasociliary nerve, which is a branch of the ophthalmic nerve, right, is going to divide and gives long ciliary nerve and short ciliary nerves. So the parasympathetic postganglionic that were once in the oculomotor nerve, they are now given, they snaps in the ciliary ganglia and they leave the ciliary ganglia as the postganglionic parasympathetic nerve within the short ciliary nerves of the nasociliary nerve of the ophthalmic nerve. I hope you got that one. Right. So the short ciliary nerve has the postganglionic parasympathetic fibers of the ciliary ganglion. So what will happen is this: they will supply, they will enter the layers of the eye, most importantly the middle layer, the vascular layer. So they'll be running within your choroid, right? And then they will supply your ciliary body right here, the ciliary muscles, and also supply your sphincter papillae muscle that brings constriction, right, of the pupil. That's what we call meiosis. You understand? And then as for the sympathetic part, you're going to have you're going to have the sympathetic coming from your thoracic ganglia. So we have what you call a superior cervical uh, plexus that will receive a sympathetic fibers from T1 that is formed high up there in the neck, and then it ascends and supply post sympathetic innervation to the head, to the structures of the head. So this sympathetic a chain or a plexus will enter the head via the external common carotid artery or the internal common carotid artery. So right here, this is your internal common carotid artery, your internal carotid artery, your internal carotid artery that is actually going to be wrapped around by the sympathetic plexus. So this is now called your internal carotid plexus. So this internal carotid plexus is gonna be the one that's gonna carry sympathetic innervation to the structures, to the intrinsic muscles of the eyeball, right? So you can actually see that this is going to be your sympathetic, a branch of sympathetic innervation from the internal carotid plexus, right? That will join with the nasociliary nerve right here, and then it is not associated with the ganglia, does not interact with the ganglia, but it takes its own route via the long ciliary nerves. You can actually see. So take note of this. NB, short ciliary nerves of the nasociliary nerve, they carry postganglionic fibers of your parasympathetic. Then the long ciliary nerve that is coming from your nasociliary nerve again, it will carry the sympathetic postganglionic fibers. I hope this is square and clear, right? Good. So in terms of clinical correlates, you can actually understand that if we have any damage to the sympathetic innervation to the head and neck structures, mainly the head structures, you're going to result into with a condition called Horner syndrome. We're going to have a separate video for that, so you check it later in our playlist. So let's take a look at another ganglia.